room where we have our territorial epidemiologist, Dr. Ann Pobutsky, joining us. Very, very good morning and a happy Friday to you, Dr. Ann.
Thank you.
So where are you at now? Are you fully moved in over at the ITC?
Yes, we are, and it's going to be good because the all of the contact tracers, case investigators, and quarantine and ISO team are all in one giant room.
Wow.
And the data surveillance team is all in one room, and the lab is kind of off by itself. But they really needed the space, as did we, and because they have all the boxes and boxes of the tests that they, distribute.
Wow.
So it's beginning to the lab looks really good. It looks like a real lab, not just obstacle course with boxes all over. So it's good, even though this has been my fourth move in a year. It's been awful.
But did anybody move over to the Hakapatan building?
No, I don't think it was. I don't really know the story, but it might be that they couldn't get enough computer lines in there or phone lines, because that's the big thing for this response is computers and telephones.
Right.
I see. So never mind Hakapatan. Everybody's over at ITC.
I really don't know.
Oh, okay.
Okay.
What the other plans are.
Okay.
Doc, I guess we'll just get right into it. And I kind of wanted to start with this comment that we had in our K-Wave News Facebook Live feed. Good morning to our Facebook Live link fam. Thank you so much for jumping on. There's a new stream because Jason stepped on the Wi-Fi cable and we had to restart it. But thank you guys for finding us again. It's a question that I've kind of wondered about too, because we saw these crazy clusters with construction, with DOC. And we heard from, Dr. Cabrera and Dr. Ho was just on this idea that we can separate out the clusters and just look at the numbers that are left and then deduce that, we're sitting pretty, according to the governor. Jesse comments here. What's the difference with clusters and the general public? Why are they separating them? Wouldn't a cluster start with infection by being infected by the general public? So, Doc, if you could kind of just explain that idea or the science behind a cluster is a cluster.
These two cases were kind of unique, the DOC cluster and the H2 workers barracks, because at least from what I understand, I might be wrong, I don't know all the details, that yes, it was probably local workers who infected someone in the barracks, and then their situation, the H2 workers, is their the Bayanihan, the countrymen, the Filipinos, they socialize together, they eat together. And from what I also understand, they weren't very good about following the rules about mask wearing and social distancing. And as for the prison, stuff's always going into the prison that we don't want there, So COVID obviously is one of them. I thought it was just a matter of time before we saw a prison cluster, because we observed that in Hawaii a couple months ago, where it just swept through their prison. Yeah. But those clusters have pretty much been contained, except for the additional follow-up with the local subcontractors and the local population. So that's pretty much contained. That's why you see last weekend we had the high triple-digit numbers, and later on the week before, and we're now down to double digits again. So as Dr. Wen said, it's, we are seeing a little dip, and we hope it will continue. But it all, again, he mentioned it depends on how people behave during the holidays, because that's what's coming up. I was in Payless yesterday. All the trimmings are there, for all the holiday stuff, Thanksgiving, Christmas. So the message is for people to just try and be safe and scale it down. And if you are going to have a group, maybe a small group, have it outside. Go to the beach, open air. We really don't want to have to see large parties, because then we're going to see funerals by Christmas. Wow. Because I'm still looking at the deaths. We're at 6,416 cases as of this last night, or yesterday, and 101 deaths, which means that COVID-19 will be probably number 3 in the top 10 leading causes of death for Guam for 2020. It's always cancer and heart disease are the number 1 and number 2, and then it varies. And given our numbers, I think it's going to be number 3 or 4, which goes to show you that this is not, it's not just the colds and flu. I had somebody talking to me last week saying, oh, isn't COVID just with us? And it's just like colds and flu. It's like, no, it's more lethal if it's coming into one of the top leading causes of death for the island. And we had one death. The only symptom he had was shortness of breath, and he was dead the next day. This is not good for, again, we're talking about people at risk, elderly. I'm at risk. I'm not doing Thanksgiving. It's just me and my husband. We're not having a party. We're not going anywhere. Just keep it scaled back. That's what we're hoping people will do.
Dr. Ann, I don't want to, put you at odds with the governor and get you in trouble, but she addressed the Rotarians yesterday, and I believe she said that we have it under control. The virus.
I don't know if I could make that statement. I think maybe she was talking about those clusters, those large clusters, which have been contained, and we did a bang up job on that. But we're still seeing double digits. We had 70 cases yesterday.
Right. Yeah. So who are these, Doc? If we're done with, I'm sorry.
So it is going down. That's it really depends on the community. It's like, public health just cleans up the mess. It really is community responsibility, not just individual responsibility, but community and familial responsibility to say, let's keep this contained. We're getting closer to having a vaccine.
Doc, so if we run through and contain these clusters, pardon me if this sounds like a dumb question, but then who's testing positive nowadays?
Well, I don't have those numbers off the top of my head.
It's just community spread, basically, is what we're seeing now. With
community spread. It's still community spread, mainly household contacts. Not much you can do about that, because we have large households in Guam, and you can try, isolate your elderly, and just do what you're supposed to do if you are positive, and isolate and all that. There's, people get instructions for when we test positive.
Right. There was a new guidance that came out, right, Bree?
Yeah, for, I think, medical.
Right. And it was basically like what to tell people who test positive for the virus.
Right.
Yeah. And you want to, did you get a chance to put your eyes on that, Doc?
No. I trust them. I trust the clinics to tell people what to do, and public health probably assisted with that.
Yeah.
Because give people instructions.
Can you tell us anything about how, I guess, PIGA and the NCS area were selected for the rapid engagement team mission this weekend?
PIGA and the other one, no, I don't. I wasn't generating that data. They probably got some intel on another possible cluster. I don't know. I've been just doing other stuff.
What have you been working on then, Doc?
What have I been working on?
Yeah, I know that's a loaded question.
That's mostly just moving. We just moved.
Yeah.
And I just that's presented at the diabetes control program, their community coalition last Saturday. I think I already mentioned what we were seeing.
Yeah.
We're seeing more than half of the cases have diabetes, the deaths. And that's very different from what they're seeing in the continental U.S., where there's more people with dementia, lung problems. But we're seeing, because we have death certificate data, we have the line listing, and then we have the discharge notes from the hospital. And between those three, we're able to put together a clearer picture. Even though most people die of a respiratory, hypoxia, respiratory failure, ARDS, acute respiratory distress system, some of the underlying conditions, the main one we're seeing is diabetes and obesity, as Dr. Wen just summarized it. And then we see this pattern. Underlying conditions, diabetes, hypertension, cardiovascular disease. And we see some cancer, but not as much as you would expect, and some lung disease.
You think with the low numbers on the cancer part, is it it may be that people are protecting their family members with.
I don't know. I don't know. All we know is that the pattern is cardiovascular disease and diabetes seem to be the major risks for Guam.
Do you have any other information to provide about the reason for public health moving from this daily, I guess, sit report to now being a weekly situation report?
Well, we've actually, yes, we've been working on this for weeks because we've gotten a request for more detailed data on the clusters and the contact tracing, and a little more detailed in the demographics, the deaths, the hospitalizations, and we're trying to put that together as a weekly report because the daily numbers at this point in the pandemic, does it really matter that you get a daily summary? And we're trying to keep a daily summary going and possibly a once a week sit rep, and then have a weekly surveillance report with more detail. Again, we've been promising this for weeks now, and we just haven't had time to do it, mainly because we get caught up dealing with these surges. So the data has to be entered into the system that Stephanie set up that we're using to count all the laboratory data, all the case level data, and they were migrating it into this system we call the NBS, which is the surveillance system that we operate for reporting to the CDC, not just for COVID, but for everything else. But we were migrating, she was leading the migration of all this data into this program. Then we had these surges, and that means we have to get caught up on data entry. And we recently hired a young man who has a math and statistics background from UOG. We headhunted him, and he's with us, but he's been doing data entry. For the deaths, I've been doing data entry. We all just we do what needs to be done to try and keep ahead of this. But the idea is for a weekly report to provide a little more detail on these underlying conditions, the deaths, the hospitalizations, and a little more detail on what we're seeing with the clusters in the community. And it's a moving target. So it's really hard to say, it's just a point in time count. Even the summary numbers that you're getting daily are just a point in time count. Do we really need to know if there's 70 on Saturday and 81 on Sunday? Is that you'll get that Monday. So it's going to be a lot easier on us. We're going to try and keep a daily summary going. We'll see what happens. We're supposed to get some additional people to help with the data entry and get caught up. And the people of the community can help by not getting infected. So we don't have to add your data to our system.
Right.
Keep it low, simmer it down, and watch out for the holidays coming up, because that's where they saw a surge in Canada after the Canadian Thanksgiving. As you know, it's earlier than the U.S. Thanksgiving.
I didn't even know they did Thanksgiving, honest. Yeah.
By any chance, do you guys keep data on COVID patients that tested positive? They recovered, and then they retested positive?
No. Some of them have retested positive, but it could be they still have, dead cells in their system. But no, we haven't had any repeat infections, if that's what you're trying to get at. It's very rare, very rare. Some people have tested positive repeatedly for weeks and weeks, but that's just a fluke.
What about those who recover, Doc? I've heard just from friends, people who get the bad, because, there's the asymptotic COVID, then you got the mild symptoms, and then some people with no underlying conditions. I know of a couple who were hospitalized.
Yeah.
So when they recover, and I just read some national stories, they're maybe scarred for life. You know what I mean? Have a hard time really getting back to what they were pre-COVID. Do you? Right.
Yeah. And there's documentation about that, about people taking months to recover. It's a nasty virus. And not much we can do about that except, again, prevention message. You don't want to get infected, and you don't want, I'm at risk. My husband's at risk. That's why I'm not doing Thanksgiving. Right. Forget it. I don't want to get this virus. I could die. Yeah. That's my message. My husband could die. He's 77 years old. Even though he's fit and healthy, I don't want to get this virus. It's nasty. People take months to recover even. Some people have neurological symptoms. We've also seen a lot of people going into the hospital who later died who have altered mental states where they're all, fuzzy and confused because the disease is taking a toll on them with the diabetes, the heart problem, and then they're coming in with this altered mental state because they're confused and it's affecting them that way.
Yeah, we just had Jay. Go ahead.
Oh yeah, Dr. Pobutsky, Jason here. We had a psychiatric nurse yesterday that we were interviewing, and she said that part of something that we have never covered as of yet on this show was that a lot of people, like you just said, have psychoses that they're experiencing. They hear voices. They are they have like a
there's some obviously effects on your brain as well. So brain, heart, circulatory system, and of course the lungs, because that's where it goes in, respiratory.
Yeah.
So yes, it's really not good.
And that's something that I'm assuming a lot of people did not even consider, that there may be like a mental health component to this as well, because people say, okay, you're under a lot of stress, you're experiencing anxiety, obviously depression sets in, but they actually said there are very serious, mental health components that could linger even after if you recover.
Yeah, that's why.
Well, think about it. Think of just about the stress level in the community. About every time you get out of the car and go to the store, the mask and all that, and this heightened sense of awareness and paranoia. That doesn't mean we're all mentally ill, but we're at a heightened sense of awareness. But some people do have psychological, psychiatric, neurological symptoms, as well as the physical ones.
Plus, too, you guys
and
got
I know that it's well documented here. We have enough trouble keeping up with the physical ailments in the hospital, Yeah.
So you guys got to manage your stress, because, when you're stressing out, I mean, it sounds impossible to do in this pandemic because it's just a whole new crazy world, but got to manage your stress, because when you're stressed out and you're tense, your immune system is compromised. So get your exercise, do what you got to do to kind of just sail as calmly as you can. Doc, I wanted to ask about the CAR score. It's at 19.0 right now. And, we were just talking around the office, and I just skipping past all the math that goes into the formula of the square root of whatever to come up with the CAR score. Just as the territorial epidemiologist, maybe if you could just simplify it for us and tell us, what does the public need to do to get this CAR score down to 5?
Well, obviously stop spreading virus around and protect yourself. The CAR score is the COVID area risk score, and that's Dr. Cabrera's summary metric. It includes data that comes from public health. It includes the number of cases, the test positivity rate, the hospitalizations. There's a number of metrics that go into it to look at our risk. And as you know, it was high. It was up at 30 point something after the big clusters, and now it was 20 yesterday, and maybe it's gone down. But the idea is to show that if the CAR score goes below a certain level, that we're not seeing as many infections, and then there's lower risk. And I'm not sure if it was designed for the community or for policy development around opening the economy and bringing the tourists back in and all that. But obviously the community, there's been widespread community infections. There's been these big clusters. We still have to wear our masks. We don't have a vaccine here. Even when we get it, it's going to go to the healthcare workers first and those vulnerable at-risk populations, elderly people, just like the flu shot and the pneumonia shot. So we're not out of the woods. We just still need to protect ourselves and our families and our community by wearing the mask, social distancing. Again, try and have safe holidays. Keep it low key. Keep it in your household if you can. We're almost at the point where, sometime in the next several months, we'll have vaccine available. And they're developing plans for that. Mass vaccination, how is it going to roll out, et cetera, et cetera.
I told you
I'm
I
looking
wasn't.
forward to it.
Yeah.
I'll be first in line for the vaccine. Yeah, give it to me.
I'm trying to figure out who I'm related to.
Well, that's the next one. I want as soon as it's available.
Right.
Well, Doc.
Right?
Yeah. Thank you so much, Doc, again for your time. We'll let you finish unpacking and getting us settled in, but you always appreciate the time you spend